Like a lot of people, you've put a lot on hold. Eating in restaurants, praying in your house of worship, attending sporting events, all to protect your health. So as we all start to get back, the same people who have been protecting your health all along are the people doing the most to keep your health safe. Always. We're open for emergency care and for appointments safely for you. CHI St. Luke's Health Memorial.
We're excited to have Monte Bostwick, who is actually the market president and CEO of CHI St. Luke's Health Memorial. It's a mouthful.
It is.
Absolutely. Better known as CHI in our area. But we are thrilled to have you here, Monte. For those of you that have been listening and been watching the podcast, you know that CHI St. Luke's has been our presenting sponsor. And so first of all, we thank you for jumping on board to a podcast that no one really knew if it would take off. Mm-hmm. And now we're excited that we've got over 500 subscribers per episode. So we really appreciate you jumping on board.
Our pleasure.
But welcome. We're happy
to
have you.
Glad to be here this morning.
Yeah. Why don't you just start by telling the listeners a little bit about yourself, your background, and how you got to Lufkin?
Sure, absolutely. So as you mentioned, I guess I'll take this in a couple of different tracks, professionally and then personally. It's my privilege to serve as the president and CEO for the Memorial System. That consists of 3 hospitals here in the East Texas area, Lufkin and Livingston and San Augustine. My journey is one that, looking back, I would have never thought God's plans for me would have brought me here to East Texas. But I'm glad it has. I grew up in eastern New Mexico. I'm an old farm boy. Okay. Growing up on a farm and ranch out there. Did my schooling in West Texas rather. So Lubbock Christian, then Texas Tech. And then from there, I just kind of started crisscrossing the country with my job. Got married to my beautiful bride of 23 years, Mandy. She also grew up out in the middle of nowhere, New Mexico. Okay. And when I finished my MBA, we moved to Florida. And after Florida, we moved to Arkansas. Mm-hmm. From Arkansas, we moved to the Pacific Northwest. From there, we went to North Mississippi. From there, we went back to the Pacific Northwest. And then we went to the Gulf Coast of Mississippi in Biloxi before coming here.
So where did you not live? That might be
right. Literally, can you get any further from the Pacific Northwest to Florida? That diagonal truly crisscrossing the country. And people would say, gosh, when you'd say, hey, you talk about, well, we moved here. Oh yeah, we've lived here. They go, oh, you're in the military. Mm-hmm. Yeah, no, we're not in the military.
Yeah.
Healthcare, right?
Sure.
But I'll tell you, it's been a real blessing. We've got to experience a lot doing that, cultures and food and all of those things. So that's really been great. And from a professional standpoint, just each place we went, God allowed me to go into roles and jobs that just would prepare me for the next one as we moved along the way. But as I said, I'm a farm boy, and I have a lot of family still in obviously New Mexico, eastern New Mexico, West Texas, Dallas, and Houston. Okay. Mm-hmm. And so when I was called about the opportunity here in Lufkin, I presented it to Mandy. I was like, we didn't know much about East Texas. Texas, big state. We were West Texas, which is
completely different.
Totally different.
Like a different country.
Yeah, it is. I still, the trees here, all of these things. But anyway, I said, this is something we should take a look at. We prayed about it. Mandy's always been supportive, although she was comfortable in Mississippi. And I came for the interviews, and it was a multifaceted process. I think I was here like 2 or 3 times. Anyway, I'll move on quickly. It was funny, during the interview process, one of the main questions that I get asked was, Monte, what do you think about coming to a small town like Lufkin, a rural area? And I have to explain, look, when I say I'm an old farm boy, I graduated with 23 kids.
Yeah, you're from a small town. This isn't small.
My hometown doesn't even have a stoplight. So this is a good fit for us. Yeah. And it has been. And so, we moved here. The people of East Texas have been great. They welcomed us. We get plugged in. I've got, I said, Mandy, a wife of 23 years. She's awesome. And then I have three children, ages 16, 14, and 10.
Wow.
So they keep us busy.
Those are fun ages.
Yeah, it is. It is. And we're excited to be here. We've been here for a little over 4 years. Been really good.
Well, so what do you miss about Mississippi?
What do I miss about Mississippi? Well, where we were, specifically there on the Gulf Coast, I miss the seafood, to be honest.
Yeah.
And the whole Cajun vibe. And Biloxi is really a very dynamic place as it relates to, it's a very transient place. There's an Air Force base there.
Okay.
You've got Gulfport, Biloxi, Ocean Springs. You've got the ocean. So people were constantly moving in and out. And but I miss the food.
Yeah.
I got to tell you, I miss the food.
Yeah.
So
what is so having kind of come from, not being from Lufkin, a lot of people that we've interviewed so far are Lufkin natives. What was kind of your impression of Lufkin? What do you like about it so far? What was kind of the initial? First off, bigger than your hometown, right? So
bigger than a hometown.
Felt like a bigger city, really, huh?
Yeah. I think whenever when we first started coming here, and whether it be the interview process, whatever, there is something very real about Southern hospitality.
Oh, for sure.
Okay. And until you live in other places that are not participating in Southern hospitality, you may not fully understand. So when you come to a place like Lufkin was certainly no different. People were just warm, welcoming, engaging. And that's always a relief for when we move and my family comes in, knowing that people are going to say, hey, we're here. And for us, engaging in our church, it took us a little while to find a church home, but as we did, and every church was great that we visited, find that church home, get plugged in, people welcome you, come around you. That's just been fantastic. So we've really enjoyed that portion of it. I really like that I get a community that's going to help me bring my children up. And yet I can still have access to things like Houston, Dallas, and those things. So really,
the best
really,
of both worlds.
It is. I mean, it is. It's really been good from that perspective.
Well, I grew up in Lufkin, grew up with a dad who was a physician and a mom who was a nurse. So I remember making rounds with my dad at the old memorial and making rounds with dad at Woodland Heights. I remember watching a baby being born at the old memorial. And I remember sitting outside. He put me in this chair and he came out and the woman was screaming her head off. And he told her, I'm not going to deliver your baby until you quit screaming. And I was about 7 years old. And I remember him walking out and saying, if you ever act like that when you have a baby, then you will remember this moment. And I just remember thinking, I can't ever make a peep when it's time to have a baby.
Oh, my goodness.
That's like a memory of mine growing up, being able to do that. And so, growing up in being a part of that medical community, CHI and Memorial was always known for cancer, and that's where you went for all of that. But you have evolved into so much more now. You have a phenomenal cardiac center and everything. Why don't you tell us kind of what all you're doing and helping bridging all the gaps in the healthcare community and filling in what's needed?
Sure. Man, that's a big question. All right. So let me, let's start with, from a role and what role we play in delivering healthcare in our community and the communities throughout East Texas. And part of that is access. Helping to create access to healthcare is really important to us. There's a number of ways that we go about that, but one of those that we participate in is trying to bring physicians into the community to serve. We spend a tremendous amount of resources recruiting physicians into the communities, whether it be primary care, specialists, those types of things. And that's going to be ongoing. That's really the lifeblood of any medical community, is having the physician and practitioner services available.
Sure.
So that's one of them. And then, so once you start working with the existing physicians in the community, and I've really been encouraged with what we've been able to accomplish in that, to bring physicians in. That's one of the external portions of it, the continuum of care access. And then you get into, okay, what are we doing inside of the facility to make sure some of those gaps are bridged. And that's really where the partnerships come into play. You mentioned things like cardiovascular services. We have and enjoy a great relationship with the Heart Institute of East Texas and Dr. Bacciaretti. And when you look at some of the things we've been able to accomplish, it's only because of the partnership that we have with our physicians. Recently, we were awarded for the third year the ACC Heart Care Center Distinction of Excellence. And I think we're one of 26 hospitals in the country.
That's fantastic.
That have that, and one of 6 in the state. So that doesn't just happen. That there has to be a partnership. And that's just a reflection of the work that the team's doing. Other examples of bridging the gap. So you mentioned a little bit about women's services. We've, just recently completed a very extensive renovation of our women's area that includes both the delivery portion of it. And yes, we allow moms to scream if they need to. It's okay.
He was old school.
Yeah, right. I have 3 kids. I was there with all of them, and
which, by the way, great remodel. We shot a video when you guys did that.
I'll tell you,
it's really nice.
Looking back, when I first got here, the initial plan was to build another building, and after evaluating that and looking at, trying to always be good stewards of the resources that we have, when we looked at what it was going to cost, it's just like, look, that's just too much. We, and what we spent was a lot, but doing another building was too much. And so being able to go back and look at the unit we had and envision, if you saw it before and then see it after, as I was trying to sell the vision to our stakeholders, like, hey, we're going to do a renovation. People think, okay, you're going to put some paint on the walls and redo the floors.
No, it was a lot.
It
more
was anything but that, right? It was
Yeah.
like literally gutted, and which allowed us to go from what we had and then move also into the NICU. And we can talk a little bit about that a little bit later. But anyway, so we talk about women's services and bridging the gap. One of the things that we were able to do even just before that was partner with Texas Children's on maternal fetal medicine program. This is a program that wasn't available here in this community. So these are high-risk moms, high-risk pregnancies that otherwise would have to travel all the way down to the Woodlands or to the Med Center. And there's a number of our population that's just a real challenge for.
Yeah.
So we were able to bring Texas Children's in and say, hey, listen, how do we partner together? We set up a telemedicine program where those moms can come in. We provide the ultrasound services, et cetera. The physicians on the other side looking, working with the tech, mom right there. And I'll tell you, within the first probably month of that program being operational, there was a mom that came in. They were doing the ultrasound, and the physician was there looking at it and basically said, grabbed the Joy, our ultrasound tech, said, you need to take her over to the obs wing and start the process for a C-section. That's how serious it was. Now, that would have never happened.
Yeah.
Had that mom not had the resource here, and certainly if they were going to have to travel. That's just such a great story. I mean, that happened within the first month of it being open. And so those are the types of things that we do to engage in. And we didn't think of that. Physicians come to say, hey, what about this? Can we make this happen? And try to partner with them, grab the resources. Can we make this work? And when we do, it produces those types of results, which really impacts people's lives.
Well, it's so fun to see how far medicine has come in general, but really how far it's come in Lufkin and Angelina County, and what we're able to do and to keep people here locally and not have to send them off, where they get to stay here with their physicians and the people that they know to take care of them.
Yeah, absolutely.
It's really nice.
Absolutely.
Yeah. Well, it's fantastic. Tell us, I know that COVID has changed everything.
Yes.
So are you allowing people back into the hospital to visit, or still?
The short answer to that is yes.
Okay.
On a limited basis at this point, we have readjusted our visitor policy to allow visitors in Right now, basically, we allow one visitor
to
come in for that 24-hour period, and for all the reasons you could imagine.
Yeah.
I mean, we this is a place of healing, and the potential to introduce outside things just increases significantly if you just have free flow. So,
sure.
Yeah.
Well, at least somebody can get in to see you now. Yeah. They're not having to look through the glass at you.
Well, right. And I'll tell you, that, as far as visitation and continuing to take care of our patients, that's been really, really hard. It's been hard for our patients. It's been hard for their families. It's been hard for the caregivers because for us, having family actively participating in their loved one's healthcare is part of the healing process.
That's right.
We encourage that. We want that engagement. And so all of a sudden to say, no, you can't.
Yeah.
That was really, really hard for everybody. Mm-hmm. And I think everybody understood it for the most part. There were others, not always, but everybody understood it, but it was still very challenging. And let me caveat that with, we still, within our COVID unit, we don't allow visitors in there outside of extenuating circumstances such as end of life, etc.
Right.
And thankfully that doesn't happen very often. We're not allowing visitors.
So let's talk about the COVID unit. Are you full capacity? Like where are you right now?
Yeah. So we were very fortunate to have within our respective facilities, certainly Lufkin and Livingston, we were able to separate our COVID population. Okay. And many, if not most hospitals just didn't have the capacity to necessarily separate everybody, certainly during the influx.
And they were like on their own floor.
Right. So we took on our tower where we have our ICU, our PCU or progressive care unit, which is kind of a step down unit. Mm-hmm. We basically took one of those units, which is 24 beds, and said, that's our COVID unit. So wherever, no matter what your status was, even if you were a med-surg patient or an ICU patient, this unit could handle that, and we use that. So that really helped us. We were able to do some things with our ventilation system, et cetera, to try to make it even more safe. So as we were going through the planning process of, anticipating this event to come, that was one of the things we were able to do. Livingston was able to do the same thing and have its own separate unit. So that was really good. So we did all this planning. It was interesting because, first of all, I think I would want the audience to know that there is tremendous amounts of work and effort that go into disaster planning in facilities and communities, et cetera, all the time. It could be, mass casualty type stuff, heaven forbid, a bus wreck, hurricanes. So what we do is we basically take that same infrastructure that's already in place, incident command, and now apply it to this, what's coming towards us. And so it's really good to have that infrastructure in place. So then the planning process begins, et cetera, et cetera. And so as we were moving into this, I was really encouraged with, our abilities to formulate resources, both locally with our division and national, and how we go about making sure that we have PPE, ventilators, those types of things, both with the state helping us, et cetera. So all of that took place. And then we kind of got to this place where it's like, okay, when's it coming?
Yeah.
And there was this little lull, if you will. And, but inevitably it did.
Sure.
It if you look back about middle of July, we were about 2 weeks behind Houston's surge. We saw our census get anywhere into the mid to low 30s as a system. So that would include Livingston. And we were able to navigate that. We had some extra help from the state with some nursing personnel, which was very helpful. And then we saw that curve started to bend back the other way.
Right.
And we got down to the point where Livingston had 0. We had maybe 4 or 5. Okay. That was good. And then we saw a little back up, right? And you've seen the graphs.
Sure.
And we've kind of held steady there, really. I mean, for the last maybe 6 weeks, 8 weeks, maybe, we've seen this we'll be in the 10 to maybe 15 here in Lufkin, and 4 or 5 in Livingston, 1 or 2 at a time, maybe even in St. Augustine. They'll take care of patients. Over this last weekend, Lufkin was down into the single digits, but come Tuesday, we were back up to 14 or 15. So we're just kind of ebbing and flowing right there. Mm-hmm. I don't want to say it's comfortable, but we're managing that right now. Certainly, as we move into the winter and flu season and those things, we're kind of watching it.
Have you seen patients with flu? Because all of a sudden, normally you're hearing, the flu's starting, starting. I haven't heard the first thing about.
Can you be regular sick?
Yeah.
Is everything COVID, or can you just be regular sick now?
Yeah. So, there have been some cases of that reported. Certainly not any significant.
Not like normal.
Yeah. Not like.
And you wonder, is that because people are so diligent about washing hands and about the mask covering? I mean,
is it affecting the flu?
Well, certainly the spread of the flu is not unlike COVID in that touching and being in close contacts with others. But I think that's going to help. I think we'll know more as we get into November, December, January to see really what takes place there. One of the things that I've been really encouraged with here was our testing capabilities.
Yes.
So when you look early on, we had testing capabilities here that even many hospitals in Houston didn't have.
Right.
Mm-hmm. So we had a machine in particular that could turn around tests within 3 hours. So as people would come in, whether it be in the emergency room, if they were acute, we could quickly assert whether or not they had COVID and needed to go to the COVID unit, or whether they didn't. Even as it relates to doing testing for surgical procedures, et cetera. Now we're on this path where we have a machine that will do it in an hour. So our abilities to quickly discern that, and now the machines will even begin to tell us whether or not it's COVID, is it flu, is it et cetera, with just one test.
That's great.
So that's really good, and that I can't tell you how much that helped us. That ability helped us early on, because many hospitals were having to hold patients, sending stuff out, not getting the results back for 3 days, 7 days. They didn't know. Us having the ability to know was huge.
Your chest pain, it may mean nothing, but it may take everything. Know the symptoms of a heart attack. If you have any of them, get to the nearest emergency room. We're waiting for you. It's your health, so everything is up to you. Everything. This message brought to you by Woodland Heights Medical Center, home of a nationally accredited chest pain center. Log on to learn more.
Are you interested in buying or selling real estate? I'm Becky Coda, broker and co-owner with my husband Kevin here at Century 21 Coda Realty. We have 21 agents that are highly trained and committed to delivering an extraordinary buying or selling experience. Contact us today to see how we can help you.
We know you had a great partnership and still have a great partnership with the health district, and that y'all were helping do the drive-through testing, things like that. As my mom works at the health district, so she was constantly answering the phone on the COVID line and sending people to get tested. But talk about how you partnered with them and how all of that kind of affected your day-to-day operations.
Yeah, it was really, I was just blown away by the commitment to partnership throughout, not just with the health center, but just the county and the city as well. And not just for our county and not just for our city, but extending that out to Livingston, St. Augustine, and other places. So, the drive-through that you speak of, it was one of the first in the state to go up. That's how quickly, others were out there and talking about it. And by the time they were talking about it, we had it stood up. And so bringing Sharon and her team to the table, along with city officials and physicians, we met, we talked, we said, okay, we're going to need to get this done. We had a building that we were using as an outpatient lab draw just across from the facility. Many may have seen that. that we said, hey, that makes sense. Let's go and see if we can operationalize that. Sharon took her team, said, listen, we'll establish the call center, do the screening, those types of things. And so that partnership really worked well. And then once we started that initial meeting, we had ongoing weekly meetings with the city, county, state officials to get on and say, hey, where are we? What's working? What's not working? And it worked really, really well. And it's still working.
Yeah.
I mean, people are still going through the drive-through, getting their testing. Now, by and large, we'll send those tests out and they'll be back, usually even now within 24 hours, but at least we have a way of knowing. But that partnership has really, really worked well.
That's great.
Again, here in a rural place where people think, what can they, listen, we had it stood up well before most anybody else in the entire state. So very proud of the team and the work that they did.
That's great.
Yeah.
Yeah. You talk about the team there for a little bit. What have been some of the challenges, personnel-wise, staff-wise? I mean, these are very much front line of the front line when it comes to this pandemic that we've gone through. Can you tell us? I mean, they've been heroes for sure in everything that they've done. But can you talk about some changes that you implemented, kind of how that process has worked?
Yeah. First of all, we have an amazing team. I can't say enough about our workers and their commitment to serve. They have a heart for service, but it doesn't mean that they're not human.
That's right.
Sure.
And that they get taxed. I think early on there was the stress of what was to come and how we deal with that. And then layered on top of that, when we got in the thick of it, was the stress of taking care of those patients. I mean, to the point of when you start thinking about one of the challenges that you have in healthcare in an event like this is trying to keep your people safe and well so that they can take care of patients. And when I talk about safe and well, it's not just the physical, but emotional, spiritual, and that has been a challenge. And I'll be the first to tell you, I have conversations with leaders across the community about what they're doing to further pour into their staff so that we can help to recharge their batteries the best we can. And frankly, I think we got a lot of work to do around that.
Sure.
But with that said, our team has stepped up. They come in, they do the work, they're caring. And what we're charged with now is how do we continue down this road of COVID knowing that it's not going anywhere?
Right.
How are we going to continue to press into our team to give them encouragement? Really one of those things is just trying to give time off. The state resources that we received from a nursing perspective helped us a lot to be able to say, because we had nurses just working, and that just takes its toll on you. So really just trying to encourage the unplugging. But at that point in time, we just didn't have any other resources, to plug in and say, hey, take some time off, So really wanting to encourage that. And we have work to do around that. Right. And I express that to our team. We've got work to do around how we can better pour into them so that they feel like they're ready when they come back to take care of patients.
Well, and you've got a lot of longtime employees that have been there a long, long time. I mean, that is home for them.
Yeah.
And I think that says so much about just the environment that they work in, the people they work with.
Right.
It becomes a family.
It does.
It
does.
I think that says a lot to the commitment of taking care of your employees.
Yeah, absolutely. And that dynamic is changing. We have, one of the challenges that we face, and we're not unique to any other business as it relates to how do we go about engaging with our staff, wanting them to stay, but understanding that there's a millennial population that's out there now that is just bent towards being a little bit more nomadic. And that's okay. This is a place that we're at. We've got to learn to work within that. So how do you create that sense of family,
right?
Even in the time that we have with them? And for those that don't want that and choose, we're certainly very blessed to have that as well.
Sure.
Yeah. So that's definitely a challenge that still trying to navigate how we're going to do that.
Always.
So, yeah.
And you employ quite a few people in this community. I mean, you're one of our biggest employers around. Can you talk a little bit about that distinction, that responsibility? I mean, that's a heavy burden to bear, to employ that many people in one area.
Yeah, when I think about our responsibility for the communities we serve, certainly one element of that within healthcare is the economic portion of it. And I don't, when I say economic, I'm not referring to the economics that are generated just by having good jobs in the hospital, nursing, techs, physicians, etc. I'm talking about the fact that having good healthcare in a community attracts businesses.
That's right.
It does.
In. And so from a responsibility standpoint, that's certainly, at the top of the list for me. If we don't have that, when businesses come in, they're looking for healthcare, schools.
That's right.
Those are two of the top two. And thankfully here in Lufkin, I'm looking at our school system, Livingston same. Well, great school system, right? So if we can provide a healthcare system that helps supplement that, our abilities to attract businesses in is going to be that much more improved. So, my responsibility is, I understand it. I don't take it lightly. Healthcare is changing. We want to keep good jobs here. Tara, to your point earlier, we want to keep as much healthcare local as we can. That helps build jobs. We can't be all things to all people, but what we do, we want to do well, and for our communities to have confidence in that as well.
The chamber is so involved with trying to help bring businesses and different organizations, and I mean, the healthcare community is one of the first things we talk about, is that we are the regional healthcare hub to 12 counties, and that when you're looking at our area that we've got state of the art, and I know that you have won several nationally recognized awards. Why don't you talk about a few things that y'all have won? I know you said you won for the third year in a row with cardiac, but you've also won some things with the women's new center. And
so there's a number of things out there for us that, again, the awards that we receive are a byproduct of the work that the team does.
It's just kind of icing on the cake.
It's just a recognition of it. If the award wasn't there, it wouldn't be that necessarily that the same level of care isn't there and available to you.
Right.
But one of the things that we pursued and achieved was the Centers of Excellence in Robotics, and that's exciting. I mean, because that cuts across several specialties, general surgery, obstetrics, urology. They all use the Da Vinci robots, and there's a critical mass of patients that you have to deliver services on. And we have 2 robots here in Lufkin, and those surgeons have to deliver a certain level of care over an extended period of time in order to reach that level of service. Recently, we underwent a couple of different accreditations for both EP cardiology, cath lab as well. Stroke is another one to become a primary stroke center. So again, it's supplemental, but I'm excited that our team gets recognized in that way.
Well, it's nice to know that the work that you put in, someone actually sees that you're doing it.
Yeah. No,
Everybody likes a pat on the back.
Yeah. No, absolutely. Team does great.
That's right.
So you're doing really well at the things that you are doing. What's kind of next? Like what's up on the horizon for CHI, St. Luke's Health Memorial?
Really over the next 3 to 5 years for us, and some of this will be a little bit repetitive in what I've talked about, but it's really going to be about focusing on making sure that access is available. The COVID period has really brought to light telemedicine.
Yeah, telemedicine's huge now.
And how we go about deploying that both locally and in more of our rural markets as well. So that's going to be a real focus for us around that. We're going to be evaluating what other specialties and subspecialties make sense for us to bring into the community, what can be supported here, whether it be from a cardiac or women's services or neurosurgery, those types of things that we're constantly evaluating, new programs, new services like that. We've got some things coming up on the horizon, and I'm not ready yet to just put it out on the table.
I was just seeing if we could get a little
Yeah,
exclusive,
a little exclusive
drop here on the podcast, but that's fine.
For the past almost 18 months, we've been working on something that has the potential to have a generational impact on East Texas, and I am super excited about it.
When it happens, you'll have to come back.
I will.
Tell us.
I will. I will certainly, and I hope in the next 6 months or so to be able to do that. But super excited about the future, what it holds. We have challenges, but I'm excited about where we are, the things that we've accomplished, and what's coming up.
Well, we're certainly proud to have CHI here in our area, and we're so honored again to have you here and to have your family here and to get you plugged in, and we hope that we get to keep you in East Texas for many years to come.
As much as those moves came, when I look around at my wife, she's like, "Hey, I'm happy. They're happy. We're good.
Here.
We really, really want to make a go of it here for many years to come."
Well,
so
we hope that you're here for many years to come.
Thank you.
We appreciate your support, not only with the podcast being the presenting sponsor, but I appreciate your support with the chamber and with economic development and all that you do for our community. So thank you very much, Monte.
Thank you.
Yeah.
Thank you.
Well, we thank you so much for your time. And we also want to thank you so much for listening to the podcast. Wherever you're listening right now, if you'll do us a huge favor and go and rate and review the podcast, it helps us a ton. It helps other people who may be interested in the podcast to find it. And also, if you want to catch the video version of this podcast, it is available on the Chamber YouTube and the Chamber Facebook page as well. Thank you so much for listening, and have a great week.